Hi, my name is Katie Arbez, and I'm going to be doing my medication demonstration video now. So first thing, I pulled up my meds from the med cart, and I'm going to begin by doing my first med check. So I have my medication here, ceftriaxone for Mr. John Smith. The dose is 1.5 grams via IV, and it's 1100 hours. Okay, so just get a look at the drug monograph here. For a 1 gram vial, it says to add 9.6 milliliters of sterile water for injection for a final volume of 10 milliliters. So since his dose is 1.5 grams, I have 2 vials, and I will pull up the first full vial and then 5 milliliters from the second one. So I'm going to begin by reconstituting one of the vials first. So I'm going to swab the vials for 30 seconds each. So I'm injecting the air in the sterile water, and I'm going to pull up the 9.6 milliliters.
3, 2, 1.
Hi there, my name is
Okay, so I'm going to inject it into the first vial of ceftriaxone here. Recap that, and I'm just gonna roll the vial gently in my hands to reconstitute the medication. So now I'm going to reconstitute the second vial, doing the same thing, adding 9.6 milliliters of sterile water. So I'll swab both vials for 30 seconds each.
And the route is IV for both, as well as time October 19th at 0900. So we're
So I'm injecting the air, pulling up 9.6 milliliters of sterile water.
I also took from the currently 10 milliliters. So first,
And now I'm going to inject the sterile 9.6 milliliters of sterile water into the second vial.
Then with my syringe, I'm then going to
So at this point, before diluting into the bag, I'm going to be doing my second med check. So I have the correct drug, it's ceftriaxone, the dose 1.5 grams, so 10 milliliters from this one and 5 milliliters from that one. For Mr. John Smith via IV at 1100 hours. So I'm going to dilute in 50 milliliters of normal saline. In normal saline because he's already getting adequate fluids with his primary bag. And the rate is going to be, according to the monograph, 20 to 60 minutes. This is going to be given over 60 minutes because he doesn't have any other medications that are due. Okay. So I'm going to, before I do that, I'm just going to check the expiration dates on these vials here to make sure that the drugs aren't expired. And just quickly double check that Mr. Smith doesn't have any allergies to these medications. Alright, so I'm going to first pull up the first 10 milliliters to inject into the normal saline. I'm going to re-swab the vial for 30 seconds.
So I just do the 10 ml of normal saline. I would then grab my medication, step this
here's the first 10 milliliters, and I'm just going to quickly swab the normal saline bag before I inject that. Here we go, for 30 seconds. So I'm injecting the first 10 mils into the bag. Okay, and to recap this, and let's swab the second vial and pull up the 5 mLs for the rest of his dose.
For 30 seconds, and then let it dry.
Okay,
As well, since we already
so I'm going to pull up the
7.9 milliliters of the new medication, I'm going to withdraw 7.9 milliliters of air into the syringe, which I'll then insert into the sample vial.
Make sure there's no bubbles. Okay, so that is the other 5, so I'm just going to quickly re-swab the bag again before I inject that 5 milliliters. Add the rest of the medication into the bag. And I would also check to make sure that this is compatible with the right solution and also for his primary medication. Okay, so I'll dispose of that into the sharps container. And at this time, I'll be making my medication label for this drug. So I'm going to write the drug name, ceftriaxone for Mr. Smith. His dose is 1.5 grams and a complete volume of 50 milliliters of the drug and 50 milliliters of normal saline. Today's date, October 19th. The time, 1100 hours, and my signature. So I'm going to calculate the rate here. So I have the 15 milliliters of the drug added to the 50 milliliters of normal saline. So that will be 65 milliliters an hour. So I'm just going to write that right here.
First, I'm going to check the monograph though to see.
So I'm just going to get my tubing ready.
So the monograph tells me that I'm able
Bring that to the bedside.
into 10 to 100 milliliters of normal saline. So for this situation, I chose to do 100 milliliters.
I'm just going to do hand hygiene, perform some safety checks here. Looks good.
Oh well, I would
All right. Hi, Mr. Smith. My name's Katie. I'm going to be your student nurse today. So I'm just here to give you your antibiotic for your skin infection that you have. Can you just quickly tell me your name and your birth date, please? Thank you. So I'm just going to quickly look at your primary IV site here. Everything's looking good. Okay, the tubing is good. So I'm just going to do my last medication check here. So I have Mr. Smith receiving his ceftriaxone 1.5 grams IV at 1100 hours. Okay, so that's good. So because we're adding a piggyback bag, I'm going to lower the primary one. I'm just going to stop the primary infusion.
When they occur. So next, I'm going to write my medication.
And I'm going to swab the port.
So I'm going to include the 5 rights on it as well. So
above the pump here.
7.9 milliliters of drug.
So Mr. Smith, some common side effects with this drug, you might get some nausea or some vomiting and maybe some abdominal cramps. So please use the call bell here if you experience any of those feelings.
No, it didn't, but it just like, see, like I was recording and then it just stopped.
So I'm going to maintain sterility and spike the bag here. And attach this to the port that I have swabbed.
If you know your password.
So I will be back priming the medication, so I'm just going to unroll this here and take all the bubbles out of the IV line. Okay. Okay, so now that the line is back primed, there's checking for bubbles here, and there is none, so I will hang this.
Yesterday, mine, it like stopped.
And I'm going to set the rate for the secondary infusion at 65 milliliters an hour for a total volume of 65 milliliters.
So I would then swab.
Okay, and I'm going to confirm that, stop that, and just before I roll this, I'm going to just check the line for any kinks Everything looks good. There's no bubbles. Okay, so now that the tube is up, I'm just gonna label the tubing here with the date, time, and my signature. Okay. And I'm gonna document on my MAR. Okay, and I will return later to evaluate the site and to make sure that signs of infection are better and that he doesn't have a fever, and to also check the IV site to make sure that there's no infiltration. Okay, so I'm just gonna make sure that it's dripping here before I head out. It looks good. So Mr. Smith, use your call bell if you have any concerns, and I will be back to check on you in a little bit.